on, you guys? Waiting for everybody to get in here. Drava 212, what's going on? Pioneer Fitness, Big Tim 12, Pool Shark 8 Ball, Eddie 28, what's going on? Steffi Tom, what's going on? Coach Gar, Louis Barros, how you doing? Chrome V Tech, Above the World, Metron, how you doing, dude? I hope all is well. Hope all is well wherever you guys are at. We got a great show for you guys. Not in the studio today. All right, we're good to go. So, what's up, guys? Officially, what's going on? Titan Talk Tuesday in full effect. You're here with me, John, CEO of Titan Medical Center, and I'm here for you guys every single Tuesday to break down questions, concerns, anything that help you guys feel good, look good, or perform better. That's what Titan Medical Center can help you guys all out with. And we'll go over all the questions you guys have, on how you get maybe leaner muscle, lose weight, right? Feel better inside the bedroom, outside the bedroom, perform better all the way through and through. And I'll answer all your questions. And if you guys don't know what we do everything from hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, peptide therapies, blood work nationwide, and all different types of things from hormones to your vital organs to STD testing to food sensitivity allergy testing to amino acid testing. We do it all nationwide for you guys. So let me get into some questions here. So question, Team Love for Life. How do I make an appointment with you all? All you have to do is call 727-389-3220, and our staff will be happy to walk you through the steps on how to make an appointment. It's very simple and easy to do. We just got to get some information from you, have you fill out your new patient paperwork, and get you started. Real simple and easy. What's going on? Jessica Adequate in the house. Luis Barrios, big shout out. Hope all is well. Gene Waters, Pioneer Fitness. Love you, John. I appreciate that, man. Thank you, guys. Gene Waters, I appreciate that. Adequate said, just literally got my therapies delivered. Back surgery scheduled for 2/7. BBC 157 and TB 500 for the win and the recovery. So this is something that Jessica's been dealing with right now. She's had issues with her back. She's had surgery on her back. She's had other issues with healing before, injuries, I should say, and needed to get healing quick. And she's used BBC 157 and TB 500 previous, so she knows it works very, very well. So at this point, she's going to use it after her surgery, and hopefully that will have her coming back faster and better than before, right? Kaji Gus, what's going on? Frankie 989, my man Eric, what's up, brother? Live. You know it, dude. YG Lee, I hope all is well. 86 Ferrari, coming out here early. So I had to do an early one because my wife and me are in the Dominican Republic. That's where I'm at. I'm on my anniversary trip with her. So, I will never skip a Titan Talk Tuesday unless I'm dead or in the hospital or something's going on that's severely serious. I haven't missed one yet. So no matter if I'm traveling, not traveling, wherever I'm at, as long as I got internet signal and I can get on with you guys, I'm definitely going to do it 100%. YG Leo, what's going on? Do you take health insurance? So no, we don't take health insurance. The reason we don't take health insurance is because insurance companies really handcuff medical providers and what they can kind of do, and patients in that light, as in what they'll cover, what they won't cover, the restrictions on what blood tests they will do and what they won't do, and then treatments after that, right? So, for us, we don't think that insurance has the best interest at hand for the patients, and it definitely does restrict some of the things that medical providers can do. Plus, they don't cover most of the therapies that we offer anyway. So at that point, we don't take insurance. It lets a provider do what they want as far as test you what they want to test you on, provide the medications or regimen they want to put you on, and get you the results that you might not get from going to a general practitioner that takes insurance. Buffalo Black, what's going on? Kaji Gus, my dude, what's going on, dude? Hope all is well. How long does that weight loss drug take to work? I don't know how to spell it. So YG Lee, you're talking about semaglutide. And semaglutide is real quick, real fast. Within the first couple of weeks, you're losing a good amount of weight. Everybody's different too. And it also, also has some variables here as far as you get out what you put in, right? So if you're exercising along with this, you're eating right, you're going to lose more weight quicker. If you don't exercise and you don't, change your eating habits, you'll still lose some weight. That's the thing. I say I have a love and hate relationship with semaglutide or Aries injectable weight loss therapy because it works so good. And it's worked so good for so many patients across the board. Like I said, whether they work out and change their nutrition plan, or they don't. And obviously, the people that do see quicker and better results. But the people that don't still get results and still are happy with what's going on. Plus, a lot of these people are overweight, possibly. Some are obese, and this could be affecting their health in other ways, or could in the future. So this is something that we need to look at, and something that we want to be preventative about, and make sure that we're not gaining a whole bunch of weight. We're not having this excess weight that's going to put more strain on our vital organs, on our body, and be healthier, right? And when we know that we're in this kind of shape, we're probably not eating the best. People who are usually obese and overweight are not eating to the best of their nutritional guidance or plan that might have been put in place. And with that comes different health issues like type 2 diabetes or high blood pressure. And these cause other detrimental health issues that you could have down the line, like kidney functions, going in the toilet, fatty liver, all these different things that could affect you and your everyday health. And it doesn't happen overnight. It happens over time. All right. Alexandra, Leon, what's going on? Dwayne Shaw in the house. Pioneer Fitness. Have you ever started doing any female TRT studies yet? What are your thoughts on TRT for women? Of course. So we're not the only people that do testosterone replacement therapy for females. And we really want to call it hormone replacement therapy because you're really balancing a multitude of different hormones. It's not just testosterone. When you introduce testosterone, yes, this could help in a number of different ways for males and females. Remember, we all have the exact same hormones. We just need them at different levels as far as a male to a female. So for example, when we talk about testosterone, we talk about it being a masculine hormone. This is something that makes us men more masculine, right? But we have a higher level of testosterone than the normal ladies would have. So ladies have the exact same thing as far as testosterone, but not at the same level. So they have, let's say for us, it's 216 and 964 in a LabCorp reference range. That's normal testosterone ranges. For females, it's 0 to 40. So it's a lot less, but it helps in the exact same way as far as energy, right? It will help for mental clarity because you have testosterone receptors in the brain, help the metabolism in your body, help you put on lean muscle mass or keep the lean muscle mass that we will probably lose if we start getting old here. As we get older, we're going to start losing this lean muscle mass. And I want to talk about this in a whole different Titan talk where we just talk about that. Because as we age, we start breaking down. Our hormones start going into decline and start breaking into deficient levels. And this starts affecting everything that we're doing possibly in our day-to-day lifestyle. From sleeping to eating, motivation, energy, mental clarity, self-confidence, like all these things, they all go in that boat. So yes, and there's tons of studies on hormones with females, whether it be testosterone or estrogen or progesterone. So there are studies out there for females and males. So yes, and we have a ton of females that are on or need hormone replacement therapy because either one, they've got to that point in their age where they've hit menopause and they don't want the negative side effects that are going along with that, whether it's vaginal dryness or it's their skin start getting really dry and not as nice as it used to. Also their sex drive lowering, their energy levels lowering, all these different things that affect us affect females in the exact same way. So yeah, so females, they're definitely the exact same as us males. They need hormone replacement therapy too at certain instances in their life, just like us guys. And that's to help them improve their quality of life, just like us guys. All right. You're welcome, T for Love. You're definitely welcome. Joy India, what's going on? Laney, Queenish, David, what's going on? Can you take BPC 157 alone for torn ligaments? Yes, you can. Soft tissue issues like ligaments, tendons, muscles, all these different things, BPC 157 are really, really good for. And TB 500 too as well. Where BPC 157, you need to inject it more site specific, and TB 500 works systemically through the body. Even with that, even if I knew it was working systemically through the body, I'd probably inject TB 500 too as well, closest to the area. So it doesn't have to travel as far, right? Doesn't mean it won't get there, but you know what? If it gets there quicker, that might be better for you. But I've tried BPC 157 by myself years ago when it first came out from the pharmacies for us, for patients. I wanted to test it because I was having shoulder issues. It's also helped a lot with golf elbow, tennis elbow I've had concurrently at the exact same time. And different people with different injuries too. So ligaments, joints, tendons, like I said, even post-surgery, like Adequine, she'll be taking it afterwards. Whatever it is, it's good for open wounds too as well as far as healing those wounds. So, when you get surgery and you get cut open, you want to make sure those wounds heal quick too as well and heal as best as possible. So this can help along with that too. Vito Franco G, what's going on? Teresa Wajuli, how much do you guys run for? All right, so semaglutide. So the commercial brand is Ozempic, right? So we don't do the Ozempic, we do the compounded version of semaglutide, but it's better. The reason I say that is because with Ozempic, you're getting 2.5 milligrams of medication per ml, and that's costing anywhere between $1,200 and $1,500. Well, with us, you get 5 milligrams of medication, so it's double the dosage of what you would get, and it's only $550. So it's a lot. It's like 1/3 of the cost of what you would pay for half the dose of medication commercial. So at that point, it's a really, really good price. And like I said, it's very, very effective. There is another drug that's coming out too as well. It already has been out. Cheers the peptide, and this one's going to be a game changer too as well. And this one is going to work better than semaglutide, a little bit better. Nothing like crazy, but it does have the studies as far as that goes behind it, showing the improvement of what it could do over semaglutide, right? Really, really cool stuff. All right. Johanna, what's going on? TV Bennett. Timbo, I am Yazar. What's going on? Andrew, how you doing? Sadisa Fitness, what's up? Hope Killer. If you guys got any questions, shoot them out to me. I'd be happy to answer them for you. Custom Canine in the house. What's going on? Andy Ford, Bub 215. John, why ask why? Tanner, what's going on? Victoria, how you doing? Cool. Pioneer Fitness said cool. Well, I can't wait for that live talk. Thank you, brother. Always appreciate your knowledge. No problem. I love helping you guys out. If you guys got questions, shoot them out. What we do or anything that you might want to help with. Does testosterone have any issues with birth defects while you're trying to have a baby? So no. I actually had this discussion with somebody, I think last week. When I had my son, obviously I was on testosterone. There's been a lot of patients that have came to us that have had fertility issues that had low testosterone too as well, that went on testosterone along with fertility treatments. The answer to your question, it's not going to have any birth defects on the baby. So us as guys, when we think about these things, things that we might be doing affecting, what we're going to have when we have a child as far as birth defects or anything else, we got to think about this and just, if you don't believe it, you can go look it up. So the only thing that you're passing out to your sperm is your DNA. Now, you can damage your DNA through time, right? And this could have an effect a little bit, but testosterone does not damage DNA, and testosterone is not going to change the DNA. So, whether you think that, you're going to pass on, aggressive hormones or whatever it may be, it's not going to happen. So you're good to go there. So you can take testosterone and not worry about, getting your girl or whoever pregnant and worrying about birth defects. It's not like other drugs, like girls, like if they take marijuana, like girls, whatever they're intaking, that could possibly affect the kid. So I wouldn't recommend females maybe possibly taking testosterone. But as far as for males, when we're shooting semen to a female, none of that is getting passed on with your genetic code. Okay. Now, if you had really bad, genetics, and then you had low testosterone and just had low testosterone because that's your genetic code, that could be a possibility. But as far as you pass on anything that you're taking testosterone wise, there are other drugs out there that can affect, birth as far as birth defects. When we talk about Accutane is one of them, and that's for the skin if you get really bad acne and stuff like that. So that could definitely affect, the child's development and stuff like that. So these are some things to look out for. But testosterone, you're good to go. Jay Jacobs in the house. Billa and YG Lee. Speaking of testosterone, I got my labs back. My testosterone has doubled in a month while being on enclomiphene. That's amazing, but don't worry, I'm still coming over to you guys when I turn 21 in 5 months. So that is amazing. And remember I was telling you, I was like, enclomiphene at this dose, It will do wonders. It definitely will. It works. It definitely works, like across the board. So, we have people that come to us that, one, they might be 21 years old, and we're not really just about putting 21-year-old on testosterone without trying something beforehand. And clomiphene is a great one. There's people out there that don't want to do testosterone for whatever reason, even if they have low testosterone, they want to try something first, and clomiphene is the way to go. Also, when you're on testosterone replacement therapy, right, you need some sort of gonadal add-back therapy. So your testicles don't shrink, right? You don't have low semen volume, and you don't have tightness of the testicles or being uncomfortable. This is a great therapy for add-back therapy, taking it along with testosterone to make sure everything is good down low, and you're working at optimal levels and feeling optimal. It really does help. Shrink Dad's in the house. What's going on, Christian? I hope all is well. Dave Subi, what's going on? Haman, what's going on? Show Killer Live. Dan Wheeler, my dude, always tight and strong. It's my guy. And he bought a badge. Dan, I appreciate you, dude. He always buys a badge for me on these lives. I appreciate you, Dan. You don't have to do that. I always tell him that, man. And if you guys think that I'm giving out good content and you guys would like to buy a badge, I would greatly appreciate it. It does help me in the algorithm with Instagram as far as telling Instagram, hey, listen, this guy's got quality content we want to see and we want to hear. So I do appreciate it. I'll badge the last 3 lives. Don't forget to thank me. I appreciate you, dude. Thank you. Double R4, what's up? I hope all is well from New Jersey. Badge up, baby. I appreciate it. Commander Man Son, what's going on? Elite 813, what's up, Sabrina? You guys are going to be seeing a lot of Sabrina here lately, or in the future, I should say, at Titan events and planning some different things for Titan. Happy we're adding on some new people to the Titan team and family, and we're going to do great. All right, so I have chronic lymphatic leukemia. Will there be any issue if I hop on testosterone? I can't tell you to get on testosterone, especially with leukemia. It's really going to be up to the provider of what they're going to want to do for you, and then your oncologist. At that point, you're going to want to see your specialist. You want to get some issue or some knowledge from him as far as that goes. I wouldn't say maybe there wouldn't be any issues with it because it's totally something different, but medical providers out there might not think the exact same thing as me, and they might want to be more cautious about what's going on with you. So this is something you're going to want to talk to your specialist about just to make sure you clear it there, and then go on. But it might help you. And there's definitely some different things I think out there that can help you along with this and getting through this, hopefully, and feeling a little bit better, and then hopefully beating it. So I wish you the best of luck, and we'll be here for support for you, and I'll answer any questions I possibly can. Lots of people want to add size, and MK will do that trick, but the spike in hunger is real. So absolutely. So that's kind of what it is, right? So with MK677, it's great for putting on lean mass, right? It raises IGF-1 levels through the roof. It's the only oral, that means in a capsule, GHRH peptide therapy. It's a growth hormone releasing hormone peptide therapy in a capsule. And it's really, really cool as far as if you can take it, and it will spike IGF-1 levels. But it will kick on your G-Relin. The hunger hormone in your body will be screaming at the top of its lungs that it wants to eat. So you have to really plan for that. Don't take it and think that you're going to get around that. Now, the way to possibly get around it is take it before you go to bed, directly before you go to bed. Take it, and hopefully you'll surpass it and go past the hunger. But remember this, if you're trying to grow, you need to feed yourself. You can't be in a big calorie deficit and you're thinking you're going to grow a whole bunch. It's not going to happen. So you're going to have to eat, and that is where the tool comes into play that you need to use. Plan for the eating, right? Say, listen, I got everything set up, so when I take this, I've already ate my first meal. I'm going to take this, 3-4 hours later before my second meal, and I'm going to eat my second meal. Right? And then you'll hopefully be good. It's not going to last all day. The hunger doesn't last all day. It will last for about 15 to 20 minutes while you're eating, and you'll be gorging. So make sure you got good food. Plan and prepare for that. Because if you don't, you're going to look at anything that's around you and want to gorge it down and eat it. I'm telling you, I don't care if you don't eat it at all. Like, there's a whole bunch of sugar, and you're like, man, I usually don't eat sugar. I won't eat this. And you're like, man, I'm hungry. And you're going to eat. I'm telling you. So that's going to help you grow too as well. So you got to remember that. Eating is not a bad thing, but what you eat could be bad for you. So make sure that you're preparing yourself with your food and your water and all these good stuff. All right. Holding Outlaw in the house. What's up, brother? Hope all is well. Hee, little Sabrina. Cliff, what's going on? Arnie, what's going on? Kaji Gus. All right, YG Lee. Can we get Titan clothing even if we're not a member yet? Of course. YG Lee, for sure, 100%. I'd love you to support us. Yeah, so listen, if you guys ever want Titan clothing, you guys can go on the website, look at the website, order from the website. If you guys see something that maybe we're wearing around, and we might have another one in stock. Some things are in limited quantities, like these shirts, these tank tops, but I always get new stuff made. Whether it's tank tops, t-shirts, sleeveless, I've got hoodies, sleeveless hoodies, razorback hoodies, all different full-length hoodies. So, yeah, definitely would love you to support us, man. And yes, anybody can buy the clothing. I have a lot of people out there that aren't patients and just like the clothing. They just want to support the brand and be a part of it. And that will, that's you're part of the Titan family either way. You support a shirt, you're on the therapies, or just showing some love to us. We appreciate everything out there. High quality too, for sure, 100%. I appreciate that, Christian. The Real Hokie Pride in the house. What's up, brother? Hope all is well. John Snow, the Bird, what's going on? Brian Hug, YG Lee. What about CJC 1295 and Imperellin? Would that help with a good night's rest? Absolutely. And I'm going to talk about a therapy here in a little bit that's good for rest too as well. But CJC 1295 and Imperellin. So these are also growth hormone releasing hormone therapies, right? They're peptide therapies. And basically at this point, CJC 1295 is a predecessor to Semerelin. Semerelin is a dinosaur now. And basically CJC works by stimulating your natural pituitary to produce your own growth hormone levels and doesn't raise above that. Ipirellin. So Ipirellin is replacing GHRP2 and GHRP6 from the past. If anybody's taken these in the past, you know that it's going to stimulate the ghrelin hunger hormone just like MK677. And you're going to be like, all right, what am I eating here? Where am I going? What am I eating? But the beautiful thing about Imperellin is, and CJC 1295, is you don't get that spike like that. It just doesn't do it. It doesn't. So, anybody that takes this, and I tell them, one way or the other, I'm like, listen, if you're looking just, for some good night's rest, lean quality mass, raise the IGF-1 levels a couple points, overall anti-aging, CJC 1295 with Imperellin. Somebody else tells me, hey, listen, I want to gain some mass and muscle. I want to get bigger. I want to, do some things. Then MK677 is going to be the way to go. And that's kind of differentiate one way or the other. But for sleep, Titan Serenity. And I'll go over Titan Serenity one thing. Do you guys have MK677? Absolutely we do. We got MK677, AOD 9604, which is great for weight loss too as well. CAC 1295 with Imperellin, BBC 157, TB 500, PT 141, and a lot more. So just give us a call or text if you want. Got questions? Ask me. Yeah, ask for sure. I appreciate it, Christian. Thanks, bro, for answering my question. David, anytime, man. I'm here for you guys. The body is made in the kitchen. It is, halfway, right? I always tell people, because they were like, abs are made in the kitchen. And I say yes, and I say no. I think it really takes two parts for abs or anything else in the body. Let me tell you what it is and why. Because abs, per se, right, are muscles like anything else. So you have to work them out. I know a lot of those bodybuilders out there, some of them anyway, they say how they never work abs out, and then when you get lean, they're just going to pop out on garbage. They're either hitting it secondary or they're hitting it and not telling you. Trust me, you pop those things out by working them out too as well. Yes, you got to be lean for them to show, but from the pop out, protrude, and look nice and full, you got to work them out, get them nice and thick, those muscles, and they're going to pop really, really nice. And that's like anything else in your body too as well. Yes, people can lose weight by just changing their diet and maybe getting thinner. And yes, they will look better, but they will not gain any muscle by doing this, okay? And remember, muscle, the more you have, the more fat you're burning. So it's not a bad thing to have muscle and to carry muscle. It's not going against you. It's actually working for you. Just remember that. John Snow, big biceps. I appreciate it, bro. Real champagne poppy in the house. How much is that peptide? CJC 1295 with Imperellin is $275 for 1 month therapy package, and that's 2 peptide therapies in 1 bottle. And this is the highest dosage you could possibly do. So at that point, you're going to get a lot of bang for the buck there, okay? And you can go on for a long extended period of time too as well. Roya, what's going on? Fire Killer, Dream Woman 21, how you doing? Official Jono Gonzalez, how you doing? Strength Addicts, something everyone should sign up for, this new Titan newsletter. That's true. So listen, if you guys aren't on the Titan newsletter, all you have to do is text the number 22828 and put the word Titan Medical in the subject line, and you guys will be entered in on the newsletter. You guys go do that after the live, please. BB Fitness, what's going on? Quanjum, Beast, what's going on? That social join. Real Eden Lake, how you doing, Real Eden Lake? I hope all is well. Hey, if you got any questions about what Titan Medical Center can do for you as far as feeling better, looking better, performing better, please shout it out. Whether you guys are trying to lose weight, improve your game in the bedroom, improve your game outside the bedroom, right? Have better mental clarity, improve your quality of life day to day, then you guys need Titan Medical Center. We can help you out in one way or another. I promise you guys. Because it's all about living optimal, right? It's all about like feeling your best every day if you possibly can, getting up, feeling like you got some good rest the night before, and getting ready to conquer the day that's ahead of you, right? Whether it's, your job or working out, your family, or anything else like that, you guys want to feel your best because ultimately you will give your best. If you don't feel your best, sometimes you don't give your best. And it's not because you're not trying to give 110%. It's just you don't feel good. So your body's not working as best as it possibly could be. Okay? The Hokie Pride, my super stack, semi-glutide and AOD 9604. That is a hell of a stack together. It's going to be great for weight loss. It's going to be great for getting rid of that visceral fat, using that stuff for energy that you're intaking food. I love it. I love it. I love it. Great stack. Topaz, what's going on? What you want? Roberto Pro, I appreciate Titan Medical Service Fall. Thank you, sir. I appreciate you too. Thank you for coming on here. YG Lee, dude, you make my day every Tuesday. You always come with good support. Thanks, man. Hey, listen, this is what I want to do. I want to support you guys out there. I want to help you guys because you guys are helping other people, and you might not even know it. You guys are answering questions, asking questions that people might have and might not be asking. Also, with you guys telling about your results and what's going on, this might be motivating other people to want to go and do that so they can be better. And they might have thought, listen, I can't do this. But you know what? When people see other people doing things, they realize like, hey, listen, I can do this. Let me do this. I want to accomplish this goal. And a lot of people out there want to lose weight, and some people have tried every diet fad out there, nutrition plan, and they just can't lose weight, and they need help, and we help those people, and it's just awesome. So I appreciate you guys tuning in and helping me out, help other people out, and like I said, you guys are motivating other people for sure. All right, so let's get into therapy of the week because I got to go here in 5 minutes. All right, so therapy of the week is Titan Serenity. So Titan Serenity is one of our amino acid therapy blends. And Titan Serenity has 3 main components in it. They're going to help you guys rest, relax, and hopefully get that deep rest that you are looking for and that you need, right? Your body needs, it craves. So let's talk about it. So the 3 components in it are L-theanine. L-theanine is an amino acid that will help you definitely relax. Even if you have social anxiety, this is great for social anxiety. It's not going to put you down right when you take it, but it's going to let you relax and slow those wheels down. There's multitude of different types of sleepers. 2 main ones, though. One, the wheels can't turn off. They can't go to sleep. Or the other one, they go to sleep and they keep waking up hour on and hour off, and they just don't get good rest at night. So if you're one of these sleepers, this could be the therapy for you guys. So the next component is magnesium. Magnesium is great for relaxing you too as well. It's great for distributing hormones throughout the body. It's going to help you rest and relax. And hopefully that will put you it will help you go into a deep sleep, right? The other one that's in this bad boy. So we have L-theanine, we have magnesium, and we have taurine. Taurine is great for brain function. It's also good for rest. So you might see taurine in a number of different things like Red Bull and all these different things. It doesn't give you energy. It's great for calming you down. It's great for anti-cramping. It's going to be great for your brain function. So these are the different things that can help, right? Real Eden Lake, what would I recommend? Let me know what you're trying to accomplish, and then I'll tell you what we could possibly do for you that could definitely help. I am Chef Tara in the house, my dude, the chef. He's the best. Jossie Fods, what's going on? Gabe, how you doing? Not 7013. What's going on? Yeah, so Eden Lake, just let me know what you want to achieve, and then we can make a recommendation or go over something that could possibly help. I need several things. Well, just tell me what couple of these different things, and we can talk about some of the different options you may have. I've got 3 minutes, guys, and then I gotta go here. My wife is gonna kill me. I'm on an anniversary vacation here, and it's good though. I love it going with you guys. All right, so it was a two-part PODT. Oh, okay. Well, go ahead, shoot them out. What's the two-part post? Not not said I need to sleep better. Thank you for having happy anniversary. I appreciate that. So if you need to sleep better, there's a couple different ones out there. Titan Serenity, which I just talked about, it's great. CJC 1295 with Emperellin, that's the other one. I would use those two therapies, and they should help you out with sleeping. One should help you out with getting better rest. With CJC 1295 with Emperellin, you're getting more anti-aging benefits along with it. With Titan Serenity, you're going to get more of a balance of distribution of hormones. You're going to get more of a rest and relaxation feel and effect right when you take it too as well. I appreciate it, Dan. Thank you, brother. I hope all is well with you, man. Strength Dennis, thank you. Brett Brown, thank you. Kaji Gus, I appreciate you. Thank you, sir. All right, so Eden Lake, if you want to shoot out the two-part question, I would love to answer before I get off here for you. Yeah, I want that one. So it's real easy. All you have to do is just call or text us, 727-389-3220. All right, so Real Eden Lake said, sorry, bad connection. Weight loss and improving insulin response. Develop resistance for final immunotherapy. Boom, I got one for you. You ain't going to need anything else. Semaglutide, our Aries injectable weight loss therapy. It's going to be great for weight loss. It's going to reverse insulin resistance. Okay, so it's going to increase your insulin response. You're not going to get any resistance. So if you have that right now, semaglutide or Aries injectable weight loss therapy is going to be the one for you to take out both of those issues that you got going on. So that was an easy question. What's up, Big Drew? Big shout out to Big Drew, my dog, my brother. All right, so I think that's it, guys. Let's do the poll question real quick. All right, so do you have trouble falling asleep or staying asleep? 17% said yes, I have trouble falling asleep. 23% said no, I sleep just fine every single night. That's awesome. 30% said yes, but I have trouble staying asleep. Remember I was telling you about the two? 30% said yes, I have trouble falling asleep and staying asleep. So you see how those two sleepers, really, it's crazy. Newsletter text number again. Yeah, it's all you have to text is the number 228. So 22828. So 22828, if that makes it any better. Is it pound? No, it's 22828. And then all you have to put is Titan Medical in the subject line. Okay. Really, Lake, you're welcome. Okay. Listen, Dream Woman, if that doesn't work and you guys really want to get in the newsletter after the live, just go to our bio, and in the link is our link tree. If you go in our link tree, it will give you the newsletter button right there. You can click it and go right to it and sign up right there. All you guys should do this. Shaped by Sarah, what's going on? Silverback Gorilla, what's going on? All right, so poll question. Listen, all the people on here, majority have a problem staying asleep or falling asleep. Some people have the problem of doing both. There's only 23% of people out there that are having a great time sleeping well at night, every single night, and God bless you guys. All right? I want to do that. I can't even do that because I don't even get enough sleep. So, and that's something I got to improve on. That's something I know I need to improve on. All right, so I love you guys. That's it. I'm going to go take my wife to dinner. And I appreciate all you guys tuning in with me, John, CEO of Titan Medical Center, every Tuesday, 6 p.m. Titan Talk Tuesday with me, John, CEO of Titan Medical Center. I appreciate all you guys joining me early too today without any warning. I didn't put it out there, and I just want to see how many people would tune in. So I appreciate all you guys for doing that. Love you guys. Appreciate you guys. And I'll see you next Tuesday. Get your questions ready, and I'll answer them live with you guys. Love you.